The last aspect of this tutorial will involve the pelvis examination. For the examination of the pelvis, the simple thing that you have to do is you have first to inspect the pelvis. You can have a distended pelvis. You can have all that, like in a case of an acute urinary retention, where the bladder can be full. Like in a trauma with a collection of blood in the pelvis, you're going to have a distended pelvis. The abdomen is not going to be distended, but the pelvis is going to be distended because the peritoneum is out of the pelvis. So, inspection can have a distended pelvis. On palpation, the next thing you have to do is to do open book and closed book morphology. You try to move it up and close at the level of the anterior superior iliac spine. If you have a open book and closed book dimorphism, it means that there is a fracture of the pelvis. The next thing that you have to evaluate when you are doing pelvic examination is that you must measure the apparent length and the real length of both lower leg. So the apparent length is measured from the umbilicus to the medial malleolus on both sides. And before measuring, you must make sure that the limbs are symmetrical. And the real length is measured from the anterior superior iliac spine to the medial malleolus on both sides. Now, if you have a patient that has a limb shortening on the apparent length, but the real length is normal on both sides, it means that there is a fracture of the pelvis only. So that is how you can evaluate the apparent and the real length from the pelvis. The next thing is percussion of the pelvis. So you percuss at the level of the pelvis. In cases where the bladder is full, we are going to have dullness from the suprapubic region upward in the case where the bladder is full, unless you're going to have a tympanic sound. The next evaluation of the pelvis, the next organ that you have to evaluate in the pelvis are the vagina and the uterus. So in this case, it's only in case of a female where you are going to do a digital vaginal examination and a bimanual examination. Similarly, in pelvis examination for the males, you have to evaluate for the rectum by doing a digital rectal examination, and you have to evaluate for the pelvic, the pouch of Douglas in female, and the recto-vesical pouch on the anterior aspect of the digital rectal examination. And now, when you are doing digital rectal examination, there are elements that you must bring out. The first element is the inspection, that is the anus. When you inspect the anus, you must see if there is any abnormality like an anal fissure. The next thing is on entry. When you are entering the anus, you must feel the anal tone and anal sphincter if they are normotonic. The next thing, you feel now the rectal mucosa if the rectal mucosa are normally and they are continuous. The next thing is to feel the content of the rectal mucosa if there is the presence of fecal matter. And then the last thing is to feel the anterior aspect of the rectal mucosa to touch the prostate in male, and to also touch the recto-vesical pouch in male. So when you palpate the prostate, there are elements that you bring out on prostate examination. You say if the prostate is enlarged, you say if you are capable, if the prostate is smooth, you say if the prostate is firm or it is soft, or it is hard, or it is stony. You say if you are capable of feeling, if they are capable of feeling the medial sulcus of the prostate, and then you say if you are capable, if there is any tenderness of the prostate. And then the next one is the recto-vesical pouch. The recto-vesical pouch is slightly above the prostate on the anterior rectal wall. When you touch the recto-vesical pouch, tell if there is a tenderness of the rectal pouch or if there is any fullness of the rectal pouch, because there may be collections there. And then similarly, you have to do that again, female. So these are all the aspects that you have seen on this physical examination. So don't forget to like and subscribe to our channels. Thank you.